With respect to its birth and fertility rates, the United States has two overlapping yet dichotomous problems. The first is the decreasing fertility rate and increasing age of first-time mothers, and the second is its very high teen birth rate, the highest among all developed nations. Our article discusses how both of these issues are due to limited access to proper reproductive health care. Hello, my name is Dr. Dara Dilmagani, and I'm a research temporary professional in the Department of Nephrology and Hypertension at Mayo Clinic. With my colleagues, Drs. Alessandra J. Ainsworth, Carl A. Nath, and Vesna D. Garovich, we've authored a perspective article appearing in Mayo Clinic Proceedings titled Decreasing Fertility Rate in the United States, Demographics, Challenges, and Consequences. Overall birth and fertility rates have been decreasing since 1960 within the United States. This is a demographic shared by many countries, but most significantly affecting the developed world. However, also as a dichotomy, the U.S. has the highest teen fertility rate among all developed nations, at 15 per 1,000 births. Regarding the decreasing fertility rate in the United States, overall births have declined 45% average between 1960 and 2002. The U.S. fertility rate in 2021 stood at 1.664 children per woman. Note that population replacement levels are 2.1 children per woman. And there's been an increased age of women at parity. Notably, women aged 30 to 34 had higher birth rates than those in the 25 to 29 and 20 to 24-year-old age groups. With regards to the U.S. teen birth rate, data shows that despite the fact that there's been a 76% decline in American teen births between 1991 and 2022, the U.S. has the highest teen birth rate among industrialized nations at 15 per 1,000 births. The National Surveys of Family Growth and Youth Risky Behavior Surveillance data reveal that patterns for this teen pregnancy rate in the United States. Socioeconomic marginalization leads many teen girls to have kids while young and unmarried. Teens in the highest socioeconomic inequality states are more likely to give birth than teens in the lowest inequality states. Teen births are more likely in those in poverty or single-parent households, and teen births are more likely in the daughters of women who are high school dropouts than those of daughters of women with some college education. These surveys also show that the U.S. teens are less sexually active compared to some of their European counterparts. However, there's less contraceptive use in U.S. teens compared to other developed nations. U.S. teens are more likely not to use any contraception, and U.S. teens from lower income backgrounds are likely to choose condoms than more effective contraceptives. With regards to the implications of the declining fertility rate, older women now account for the U.S. fertility rate. The deferment of marriage and childbearing has resulted in couples desiring pregnancy later in life with the associated decline in fecundity and fertility. Notably, there is a doubling of assisted reproductive technology, ART, use between 2012 and 2021. However, the analysis of supply versus demand data shows that only 24% of U.S. ART need is currently being met. Therefore, the U.S. clearly lags behind other OECD member states with regards to meeting ART needs. In 2009, the World Health Organization designated infertility a disease. Therefore, this dispelled infertility care as being elective. But within the United States, the U.S. Supreme Court rulings have affirmed states' responsibility to protect individual rights, but not necessarily to provide for them. Therefore, the right to procreate has been severed from state-sponsored underwriting of infertility services. There's also regional disparity of ART centers in relation to residential locations of populations in reproductive years. Of the 453 CDC reporting ART centers, the highest concentration, greater than 95% of the population living within 60-minute driving distance, are located in the Northeast United States. All of these are mandated states, and notably, they're all major metropolitan areas. The lowest concentration in Alaska, Wyoming, West Virginia, and Montana have less than 25% of their population within 60 minutes of an ART center. With regard to solutions, it's noted that society is dependent on population growth for success. Slow-growing populations have an increasing elderly dependency ratio. That is, people aged 65 plus to those aged 15 to 64. And they have a lower potential support ratio. i.e., fewer people aged 15 to 64, that is, within the working age group, to those aged 65 plus. Therefore, fewer workers are supporting the elderly. Thus, beyond immigration policies, for population growth, you require increasing the birth rates, which requires socioeconomic support for reproductive health. Increasing coverage and utilization of fertility services addresses this population growth problem, but restrictive underwriting imposes high rates of underinsurance, uninsurance, and out-of-pocket costs. Thus, ART use is highest among women with higher household incomes. With regard to the solution to the teen pregnancy rate, this is also due to limited access to reproductive health care. A solution is to improve the access to effective contraception and reproductive health education. For young women to prevent teen pregnancy, it's important to recognize teenage girls who are socioeconomically most at risk for becoming teen mothers, and to provide them with appropriate sexual health education, including the use of more effective contraceptive methods, whether it be OCPs, Depo-Provera, longer-term contraceptive methodologies such as IUDs. And for women wishing to begin childbearing, in states without mandates, lobbying so infertility treatment is included is important, making women aware of the assisted reproductive technology services that they can utilize if desiring pregnancy and facing infertility, and to discuss desired fertility plans on an ongoing basis so difficulties with conception and advancing age are recognized as a risk factor and possible preemptive actions can be taken beforehand. What this means for patients is that it's encouraging them to enroll in insurance programs providing fertility coverage for women in advancing childbearing age, and providing information to patients regarding infertility risks with advancing age. With regard to the next steps for this line of research, researching which pronatal policies nationally and internationally which have resulted in the greatest contribution to increasing fertility rates is important. For example, several countries have much longer maternity leave programs. Many countries have subsidized daycare. And there's tax incentives and financial benefits for families with young children. It's important to determine which of these policies, individually and/or in combination, have affected fertility rates the most, which would be a promising line of research which can affect U.S. national policy. Thank you for your time and viewing of this video. For further information, I invite you to please read the full Mayo Clinic Proceedings article.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.